Good afternoon, everyone. I'll be presenting largest case series on fish hook injuries. I have no financial interest. Engaged both as an occupation and a pastime, fishing boosts a widespread popularity across the globe. Penetrating ocular injury with fish hooks is usually uncommon, but if it occurs, it is associated with corneal lacerations, traumatic cataracts, choroidal hemorrhage, vitreous hemorrhage, retinal detachment, and endophthalmitis. Usually fishing related ocular injuries are underestimated and underreported. This case we aim for to underscore the imperative of recognizing fishing related ocular injuries, acknowledging their potential severity, outlining the successful surgical approaches for their management, and promoting preventive measures to mitigate visual impairment. This is a retrospective study and done for a period from 2003 to 2023. All the patients with fish hook injuries were included. A total of 21 cases were included at the follow-up of post-operative day 1 week and 1 month, with 3 months follow-up and every 6 months after that. Most of the patients presented with the age from 9 to 59-year-old with a mean age of 29.4 years, and most of them 90.4% are males with 9.6% females, and 85.7% are from rural coastal areas, and time of injury to the presentation is less than 12 hours in 61.9%. 80.9% were open globe injuries, and 14.3% are blunt trauma. Barbed are seen in 6 patients, 8 are barbless, and 3 details are not known. Second surgery has been done in 10 cases out of 21. Corneal transplantation was done in 2 cases, cataract surgery in 3 cases, vitreoretinal surgery in 3 cases. After poor initial best corrected visual acuity, presence of infection at the time of presentation, delayed presentation beyond 12 hours, and retina and vitreous involvement at the time of presentation were found to be significantly associated with poor visual outcomes. Safe removal is always challenging. Incorrect removal can create more damage to the ocular tissues. So for the proper removal technique, we should know the basic parts of the fish hook, which is eye and shank. It has a bend, barb with a point, and a fishing line. Fish hooks can be divided into barbed and barbless. Barbed based on the number and location of barbs, single, triple, and multiple. These should be noted because these details are very important to determine the best removal technique. Methods of fish hook removal are back out method. This is backing out the hook through the entrance wound. This technique is a simple technique, and this is usually used for barbless hooks. And the second method is cut it out technique. A small incision is given with the scalpel blade at the entrance wound, and then sliding the scalpel blade along with the hook to the point of fish hook. After this, fish hook is simply backed out as a simple back out method. This method is used for the barbed hooks. This is advanced cutout method, advanced and cutout method. This is a photographic documentation from AIOS et al. Group. Here we cut the barb from the bend with the sterile wire cutters, and then back out the remaining fish hook. Needle cover technique, this is used for the fish hooks in the posterior segment, passing the needle bore, large needle into the eye through the hook entry, and then engaging the barb into the lumen of the needle and withdraw both together. The other is snatch technique. This is a modification of back out technique, but this is used in the non-ocular tissues because it is a traumatic technique. Downward pressure of the hook on hook shaft and rapid extraction are used to diminish the pain during the removal. Conclusion, our study highlights the significance of comprehending the anatomy of fish hook and applying a suitable technique for its removal. It is important to know the type and structure of fish hook and plan its removal accordingly. Professionals involving fishing activities must wear the adequate personal eye protection. A public self-advertising campaign in multiple languages is important to sensitize the public on eye care during fishing and related activities. These are my references. Thank you.
Thank you. That's a good presentation and very nice videos also. So how many cases you have done personally?
I did only one.
Okay.
This is like a 4 cent. We have collected the data from 4 centers,
Okay, multi-center study.
multi-center.
And ethical part? Ethical clearance part?
It is cleared from.
Okay, sir.
So I had two observations. I mean, first, when we were talking about the conclusion, you were talking that the technique of the removal is fine. So have you done any inclusion of this technique in the statistical analysis or the outcomes? Because when I'm concluding something, I have to base it on the statistical analysis or something like that. So have you done that?
No.
The type of the technique? No. The second thing is that you're talking about a very important point that you said is that many of these cases are coming from rural settings and coastal area. And have you done any studies on the microbiology of these areas? Because there is a resurgence of what is called as ocular melioidosis, right? So Burkholderia, Pseudomyeli, and all those things, which were most of the times, because this is an EPO conference we're talking, most of the times it used to be in Bangkok and Thailand, but now it is visible in the coastal areas, Andhra as well as Kerala and all. So have you done any microbiology studies, or did you end up getting some samples of some organism? Did you note any organisms there, or all of them were clean?
Some of the infection, they are infected, but we didn't get any organism like.
Okay.
Thank
Thank you very much.